Sadaf, welcome to Let the Quran Speak.
Assalamu alaikum. Thank you for having me.
You have had a close-up view of patients who are suffering during COVID and also healthcare workers. So I thought it would be interesting for you to tell us a little bit about your work.
Yes, I am a spiritual care provider and a registered psychotherapist, and I just recently graduated from University of Toronto with a master's in spiritual care and psychotherapy. And I have had internships at many hospitals and private clinic sites. Currently, I'm working at William Osler Health System, Brampton Civic Hospital, and also I have worked at Heart House Hospice. So I have some experience working for patients and clients, providing grief therapy, bereavement support during pandemic.
Now, everybody's experiencing the after effects of COVID in terms of like loneliness, anxiety, stress. But I'm guessing that for patients, they have very unique challenges. Can you tell us a bit about some of those challenges, Sadaf?
Yes, it was pretty challenging when the pandemic started. First of all, at Heart House, when I was working at Heart House, everything went online. And for some clients, online was not as effective as it was in person. So it was a lot of adjustment on their part as well as on our side as well, because it was a new way of working. Patients at the hospital, they weren't, family members couldn't visit them. There was a lot of fear, loneliness, despair. Patients were missing their family members, and especially elderly patients. They didn't really like online and Zoom visits. So it was a challenging time, and there was a lot of fear among people for not being able to see their loved ones at their end of life. So
I guess one of the biggest fears people have is dying alone, right?
Right.
And during COVID, that was very prominent.
That was real.
Yeah.
And nobody who wants that.
Yeah.
So it was a very fearful time. People really felt what loneliness is like. So yeah.
And there's this image that you have of, you see everywhere in the papers and on the news of a nurse holding a cell phone. And then there's like a pastor or a priest or a rabbi or an imam on the phone speaking or offering advice or blessings to the person who is sick. Right. And that, in some ways that's great, but in other ways it's hard. It's really, really hard.
Yes, it was accessible.
Yeah.
You could meet family and friends and healthcare providers, but not everybody reacted well that I would meet my loved one through a screen. So that was very challenging for many people. And there was a lot of requests for in-person support, but we were also, healthcare providers were also feeling helpless. They had to follow protocols, proper physical distancing and everything. So it was very challenging. And I really want to give a shout out to everybody, all healthcare providers who went through that time, and they really supported patients and staff and everybody, because everybody had their own families too. And it was very challenging for nurses as well, to provide that care for patients and also being there for their own family members. So yes, we've seen some rough times.
I guess for healthcare workers, we don't often think of them needing support too, right? But I understand from you that you are also treating and dealing with healthcare workers.
Yes, I provide staff support at William Osler, but it's one thing that you just talk about it, and another thing is when you are in it, when you are actually going through it. So
what are some of their concerns? What are they saying?
So simple things. Well, when you are at the hospital, it's not really that simple. When you say like you have to don PPE, and to provide care, having PPE on is very challenging. With your mask on, with your shield on, with your gown on, gloves on, it's very hard. And sometimes you have to stay in PPE for like most of your shift. So that was very hard. You can't eat. Even going to the bathroom is very hard. So that's just one basic challenge. On top of that, there are patients who are they're desperate to meet their family members, and then to provide that firsthand emotional support to the patient on top of the physical support was very, very challenging for nurses and other staff members.
And I guess they had to play the bad cop sometimes, right? And say like, no, you can't come and visit your loved one, right?
Yeah, and they had to hear a lot from patients too. So you have these patients, and then you go home to your family too. So
and then the patients' families are probably complaining and arguing with them.
Yeah, so that was one heck of a stressful time for people. Like some people had this, flexibility and ease of staying home and working from home, but frontline workers didn't have that. So
and then I guess there were limited resources, right? So there was always this fear that, you have to triage the patients, maybe some, you're going to have to take them off machines because others need the machines, that sort of thing, which are like ethical questions that they would have to deal with.
Yeah, ethics department was really busy. Spiritual health therapy department was really busy during the pandemic.
So what sort of spiritual care do you think was needed and you offered, and maybe others offered that as well, to the patients, to their families, to healthcare workers?
So spiritual care is basically providing emotional support to people who are experiencing a lot of fear, anxiety, anger, also guilt. There was a lot of guilt. People were caring, staff and patients. Like, and the family members of the patients, that am I a good person? Am I a good daughter or a good son? Or that am I there for my family member, for my loved one? Am I doing the right thing? I'm not even able to visit them. They're all alone. They're basically battling everything by themselves. So there was a lot of spiritual distress among patients and staff. So yeah, spiritual care is to provide that emotional and spiritual support to people, so they rediscover and explore their sense of identity, their purpose and meaning in life, and they look at new ways of forming connections. And new ways of forming connections looked like through a screen those days. So it wasn't something that people were used to. Yes, people used to FaceTime all the time, but would that be the only way of communication? People didn't know that. So that was a new way of communicating, and just helping them and supporting them, holding space for them, that they know how to deal with these emotions of loneliness, of fear, of anger. So that is part of being a spiritual care provider.
Sadaf, do you think that there will be long-term consequences to this trauma that people experience during COVID?
I really wished I could say that no, but yes, actually, people have been shaken up by what has happened. There has been a lot of trauma that people carry. Many people lost their family members and they weren't able to do proper burial or funeral rites, the last rites of the deceased. And that's a guilt that many people were carrying among some cultural and faith groups. They couldn't offer proper funeral prayers. And that's also causing a lot of spiritual distress among people. And at home, kids couldn't socialize, meet their friends. Mothers were doing online schooling, and if they were working, they had their own work and kids, basically homeschooling kids. So a lot of people lost their jobs. So there's a lot of grief that is out there because of this pandemic, and we're going to take some time to recover from all of that.
I mean, I understand that you yourself we're donning all of the PPE, outfits, and, you're going with masks and full gear. So you've experienced some of that as well. How are you coping with that?
So I didn't start William Osler at the height of pandemic, but I was there. And yes, it was very hard to talk to patients through your mask, through your screen. But I guess you do what you got to do. So you get used to it. It's annoying, but you have to do it. So you find that courage because I searched for meaning and purpose in my work. So it helped me redefine my intention. It made my work more meaningful to me. And I'm really grateful that this experience actually helped me discover my own emotional strength. So, yeah, I guess I figured out that I was capable of doing more than I thought I could. So
That's
I'm grateful
amazing.
for that.
Yeah. Thank you for all of the wonderful work you're doing, and may God bless you and give you success.
You're welcome.
If you enjoyed this video, click like and subscribe. And please donate to support our work at QuranSpeaks.com.